Hello, my name is Hemant Yadav.
Hello, doctor.
Today I'm going to discuss with you about the different family planning techniques and the method of lactational amenorrhea. So, firstly, I will need your personal details, and don't worry about these details, they will be completely confidential. And so, can you please tell me your full name?
Mustaqil Zaman Munir,
Okay, and what is your age?
29 years.
Okay, so now let's talk about your previous pregnancies. Can you tell me how many times have you been pregnant in past?
One time.
Okay, and what was the mode of delivery in your first pregnancy?
It was normal vaginal delivery.
Okay, so your mode of the delivery in previous pregnancy was vaginal delivery. Okay, and what is the age of your current child?
I have a girl and she is 3 years old.
Okay, and do you have any kind of chronic disease, chronic somatic disease, or any kind of operation, injuries, or STDs in history or currently?
No, doctor. I'm perfectly fit. Though I had a fracture in my wrist, but it was around 5 years ago and it was fully recovered till the time I was pregnant. That's
Okay, so this is a very good sign that you don't have any kind of serious problem. Okay, so let's talk about what is the purpose of your visit this time.
doctor. Me and my husband are planning to have a second child, so we need some proper advice regarding that. Like what should be the normal time gap between two children, and after that what kind of contraception we can use to avoid pregnancy.
So if you are planning for your second child, there should be at least, ideally, there should be at least 2 to 2.5 years of gap between both the child or both the pregnancies. And as you said that your previous pregnancy or your previous delivery was 3 years back, so currently you are in perfect stage of having the second child. Now the second thing that he wanted to ask is about the contraception, the method of contraception that you can use. But firstly, I want to know that were there any contraceptive methods that you have used in past?
Nothing specific, doctor. We used only traditional methods like withdrawal and fertility period awareness, but it failed and I end up being pregnant. That's
Yes, of course, these traditional methods of contraceptions are not very reliable, and they don't have. There are high chances of failure when you use them. So don't worry, I will tell you about some new and 100% reliable methods. If you are looking for a long-term contraception, you can go with IUDs and the implants. IUD stands for intrauterine devices. Now these both these solutions comes with a lifespan of 3 to 6 years. Now, and the process of applying these you can say devices and implants is very simple. They are not at all complicated, and once you have applied these devices or implants, you don't have to worry up to the long term period like 3 to 6 years. Okay, so next method is the method of lactational amenorrhea. So lactational amenorrhea is also called as the postpartum infertility. It is the temporary postnatal infertility that occurs when a woman is amenorrheic. That means she is not having her menstrual cycles and she is fully breastfeeding. Now the duration for this lactational amenorrhea period is around 6 months. Now, if you want to know how this uh, uh, method acts as a contraceptive method, basic physiology behind this thing is when the mother is going through, you can say, breastfeeding. She is breastfeeding her child. Due to that suction impulse or suction stimuli by the child, there is a cascade of hormone changes in the mother's body. For example, the gonadotropins like GnRH, or you can say LH and FSH, all these hormones will decrease. But on the other hand, the prolactin, that is the milk producing hormone, will increase. So all these hormones, like as I said before, LH and FSH, they will decrease and they will cause cessation of the menstrual cycle. So this cessation of the menstrual cycle is a very good opportunity, or it acts as a contraceptive, natural contraceptive in the female. Now there are three basic, very important things for this method to work as a contraceptive. Is number one, that the baby should be at least under 6 months of age. Number second is the mother should be still amenorrheic, that means the menstrual cycle should not have been started. And number three is the mother should exclusively practice the breastfeeding techniques as per the requirement of the baby. Okay, so now if you want, now you can ask me about the effectiveness of this method. And lactational amenorrhea method is around 98% of percent effective as compared to other good, you can say, contraceptive methods in this field. And it is also a very reliable method, but just you have to keep all the 3 points that I have mentioned in your mind, and you can go on and you can choose this method.
Okay, doctor. I understood all the methods of contraception and I'm thinking to use an IUD or implant after my next child.
Sure, that's a good option to go with, and I hope I have made all my points and your doubts clear. But still, if you want to ask something, feel free to ask.
No, doctor. I'm clear with everything and I'm very thankful that you shared all this information with me.
You are most welcome. So today's session ends here. If you have any kind of problem or doubt in future, feel free to contact me anytime, and I will be available.
Sure, doctor. Goodbye.
And goodbye.